Hello everyone, welcome to this edition of 12 on Health. You're watching News 12 Connecticut, as local news gets. These days, if you want to have a baby and you don't conceive on your own, there are various options, many of which hinge on amazing advancements in fertility technology. And here to tell us what is possible is Dr. Michael Doyle, Medical Director of Connecticut Fertility Associates, or CFA, which, by the way, is growing. CFA has offices in Norwalk and Bridgeport and a new one in Orange. Welcome, Dr. Doyle.
Thank you, Jillian.
It's unbelievable. Every time I interview you, there's another office, there's more babies in the world. I don't know what's going on here. It seems like because there's so many advancements in fertility, there's this feeling that anyone can get pregnant, right up to the age of 45.
You're right. There is the feeling that more and more can be done. And actually, that's true. But what hasn't changed is that there are still some biological limitations, and there's still some need to stick to the tried and true basic tests to figure out what's working, what problems may exist, what imbalances may be present, and then still to focus the therapy on usually just one and occasionally more than one of those variables.
If a couple is trying, how long should they try before they seek fertility help?
That really depends on a few things. If a woman is 40, for example, she might be wise to not spend that full year of trying that a younger woman might use, especially if that younger woman has conceived in the past. And as well, if somebody's never been pregnant in their life and has reason to think that there could be a problem, like, I know I have endometriosis, or I know that I don't ovulate because my cycles are irregular, then again, the whole year of playing that out naturally probably isn't the best use of her time.
Tell us about the most recent development in fertility.
Well, even though most patients don't need in vitro fertilization, because most patients, 75% of patients, can get pregnant without it, all the big advances really do lie in the field of in vitro fertilization, or IVF.
And that's fertilizing and taking an egg from a woman and sperm from a man and fertilizing, creating the embryo in a petri dish.
Exactly. In fact, multiple eggs. The most advancements in the field of IVF in the last couple of years have to do with answering the question, how can we be absolutely sure that the embryo that we put back into that woman has the highest chance of success? And the techniques now include not just looking at them and grading them, actually, like a teacher might grade a student, but grading them based on DNA testing. And when we do embryo biopsy safely now and routinely, PGD, which stands for pre-implantation, before you put the embryos back in, pre-implantation genetic diagnosis can all but assure that when that embryo does attach, that not only a pregnancy is likely to occur, but that it'll be a healthy pregnancy with healthy, normal chromosomes.
Oh, that is amazing. Yeah. We've got questions. We ask people in the field. A lot of people are curious about fertility treatment. And so let's go to the first question. A woman who has a question about the age.
If you're over 35, is it more risky to have children the older you get?
Well, that's a great question. It actually depends on the person, because there are many women in their late 30s and early and even mid-40s who are much healthier in both mind and body than a teenager who, unfortunately, we know are sometimes able and are getting pregnant. So that the age of the woman carrying the pregnancy does define certain risks, but a healthy woman into her late 30s, early and mid-40s can usually carry a pregnancy without significant risk, especially with good prenatal care.
And
now getting pregnant is different. It's harder to get pregnant in your 40s than it is in your 30s for many people, for most people. But
once they
that
are
person,
pregnant,
you got it.
They have a good chance of carrying it to term.
Right.
Oh, that's great.
Right.
Okay, we've got another question, and this one has to do with whether or not the doctors ever get stumped.
What percentage of women who are trying to get pregnant cannot due to unexplained reason?
That question has really two parts. Most people can get pregnant on their own, sooner or later, and with one approach or another, but about 15% of people can't, as a general statistic, and that's the population that we refer to as subfertile or infertile. And when we see those patients and perform just basic tests for over a month or so, 4 or 5 tests, in about 80% of those patients we can figure out what's wrong and direct specific therapy. So about 20, no more than 25% of the patients that I and my team work with have an unexplained component. It's frustrating when you go to a specialist and somebody says, we're going to do all the tests, and everything keeps coming back normal, normal, normal. But ultimately, unexplained infertility is highly treatable with the types of treatments that include fertility drugs and in vitro.
How many times do you recommend somebody try with in vitro fertilization or artificial insemination before you suggest they call it quits?
Well, that's a highly individual question as well. Most therapies have a statistic associated with them. One cycle of in vitro fertilization in a young, healthy woman, 60 or 70% likely to work in one try. So that's a therapy that really should work within one or maybe two tries, and seldom is it necessary to do the third and beyond. Whereas a treatment, a low-level treatment that someone might choose to start off with, like Clomid, a pill, a tablet, might only have a 15% chance of working per month. So you really need to do that 6 times before you start thinking about alternatives, or maybe 3 or 4 times. Okay. Depends on the age of the person too.
We're running out of time, but I want to show folks your handiwork. At Connecticut Fertility Associates, here's one of the babies you helped bring into the world. And this one, this is so cute. How emotional is it for you? You're involved in bringing so many babies and children into the world.
It is emotional. We remain very objective and very professional, of course, but it
Don't
is,
you love
it
this
is a
one?
really
He's king for the day,
yeah.
or probably for a lifetime.
Probably
He's
for
so
his life,
cute.
knowing him. It's a highly rewarding and emotionally positive experience for me and my whole team, because we get to share in the process before and during the conception, and then more often than not we get to see the babies afterward too, when all the excitement dies down. That's wonderful. I know you hold parties. Treasure.
Thank you so much, Dr. Michael Doyle of Connecticut Fertility Associates.